So what is the future of health? Well, it turns out it's a battle being fought on two totally different fronts. On one side, you've got these incredible, high-tech cures, and on the other, the surprising power of our own daily choices. Let's dive in and see how these two kind of opposite forces are shaping everything.
Okay, so why is this conversation so important right now? It all comes down to this one number, 71%. According to the World Health Organization, that's the percentage of all deaths worldwide that are caused by chronic, lifestyle-related diseases. That's not just a statistic, that is a massive call to action.
So the big question is, how do we even begin to fight back against a crisis this huge? Well, the answer seems to lie in two really powerful but very different approaches.
All right, first up, let's explore the high-tech battlefront. We're talking about the world of precision medicine, where technology is giving us these amazing new ways to fight disease on a deeply, deeply personal level.
So what in the world is precision medicine? For a long time, healthcare has been kind of one size fits all. Precision medicine completely flips that on its head. It's all about using a super detailed understanding of your unique genetic code, your environment, and your lifestyle to tailor treatments specifically for you. One of the most exciting things happening in this space is the rise of AI diagnosticians. We're talking about deep learning models that can look at a digitized biopsy slide, spot cancerous regions, and even predict how a disease might progress, sometimes with a level of precision that can be a huge help to human doctors. It's pretty incredible.
And if you thought that was cool, get this. We're now seeing the development of personalized cancer vaccines. The way this works is just wow. They use gene sequencing and machine learning to figure out the unique genetic signature of a patient's tumor. Then, and this is the amazing part, they create a custom vaccine to teach that person's own immune system how to hunt down and fight that specific cancer.
And this all leads us to another game-changing field called multi-omics. The best way to think about it is like creating a complete molecular map of a patient. By analyzing everything at once, their genes, their proteins, their metabolism, the whole shebang, we get this unbelievably clear, data-rich picture of what's going on inside someone's body. And listen, this isn't just some far-off, futuristic idea. The money is absolutely pouring in. The multi-omics market is projected to more than quadruple in just the next decade. We're talking from around $3 billion to over $12 billion. That kind of investment tells you just how much belief there is in this approach.
Okay, but let's pause for a second. These technologies are incredible, right? But they're mostly designed to treat us after we're already sick. Is that our only play here? What if we could get way out ahead of the problem and tackle the root causes of these diseases before they even start?
And that brings us to our second front, the mission to unlock our own inner code. This is all about the science of behavior change, diving into the nitty-gritty of why we do the things we do.
And the potential here is just staggering. Look at this. A landmark study found that simple lifestyle changes, things we can all do, like better nutrition and more activity, could prevent the vast, vast majority of our deadliest chronic diseases. The power of prevention is just enormous. So to understand how we can change our behavior, we first have to understand that there's kind of this battle going on in our own heads. Think of it like having two systems. One is your goal-directed system. That's your slow, conscious willpower. The other is your stimulus-driven system. That's your fast, automatic habit brain. And guess which one usually wins? Yeah, the automatic one. And if we dig even deeper, neurobiology shows us that our actions really boil down to three core motivations. You've got approach, which is moving toward something good, like grabbing a healthy snack. Then there's avoidance, moving away from a threat to feel relief, like deciding to skip a stressful situation. And finally, assertion, which is that feeling of comfort that makes us want to just keep things as they are.
So now that we know a little bit about how our brains are wired, how can we actually use that information? Well, it turns out there are three really powerful, practical tools for making change happen.
First up is facilitating. And this one's probably the most straightforward. It's all about changing the world around us to make the healthy choice the easy choice. If there's a great fitness trail near your house, you're just more likely to use it. It's all about removing those barriers.
Second, we have boosting. So if facilitating is about changing the world outside, boosting is all about strengthening our skills on the inside. This is about building up our own mental toolbox. Think nutritional counseling that teaches you what to eat, or mindfulness training that helps you build self-control.
And finally, we've got nudging. And this one is maybe the most clever of the three.
Instead of trying to fight our automatic, kind of lazy brain, nudging works with it. For example, simply putting fruit at eye level in a cafeteria makes it the default, easy choice. Your automatic brain just grabs it without thinking. It's brilliant, really.
So where does all this leave us? We've got these two very different worlds, the high-tech lab and the psychology of our daily lives. The really big idea here is that the future of health isn't about choosing between them. It's about combining them. It's got to be both high-tech and high-touch.
The key takeaway here is that we have to fight a two-front war against disease. We desperately need the high-tech cures like personalized vaccines for people who are already sick. And, at the same time, we need the high-touch prevention tools like nudging and boosting to keep millions of people from ever getting sick in the first place.
To put it as simply as possible, we need both. We absolutely need AI reading biopsy slides for the sick, and we need to be boosting mindful awareness and building healthier environments for the healthy. One is treatment, the other is prevention. They have to go hand in hand. And this leaves us with one final, really big question to think about. As we pour billions of dollars and our brightest minds into shaping the future of health, where's our best bet? Is it in building ever more amazing cures for when we're sick? Or is it in the complex, messy, human challenge of building better habits from the start? The real answer